Are you struggling with reconstitution, the skill part of it? You don't know how to mix it and all that kind of stuff? Or are you struggling with the math part of reconstitution? Well, guess what? This video is for you. Hi, I am the Nurse Doc Tutor Asia, and I am here to make sure that you, yes you, pass nursing school. So today's lesson will be on reconstitution, the skill, and the math. So let's get started. So let's start with the math portion first. So when it comes to reconstitution, all that means is we're going to be mixing. So you may start off with a powdery substance, and then you need to give it in the IV, or you need to give it with an injection, right? So you would have to turn it into a liquid. So you want to make sure that you read your medication label to figure out how much solution or even what type of solution that you need to be mixing with. So let's start with this label. So cefalozolin, which is the antibiotic, it says that there's going to be 500 mgs per vial. Okay, so then we're going to go over to our the side of it. So it says that the usual adult dosage is 250 mgs to 1 gram every 6 to 8 hours. Okay, do we really need to know that? Not really, unless our question is asking us like, okay, is this dose safe? Now, if our question is asking, is this dose safe? Then yes, we would need that information. Now, the part that says before reconstitution. So it tells you what to store it at. And then after reconstitution, it tells you what to store it at. Now, let's go to the reconstitution part. It says for IM use, you want to add 2 mLs of sterile water for the injection. And then you want to shake it well. All right, so then it says that it provides an approximate volume of 2.2 mLs, which will give you 225 mgs per ml. So it lets us know how much we need to dilute with. So it says that we need to dilute it with 2.2 mLs of sterile water. So what I like to start with is, I like to start with what the physician has ordered. So let's read the order. It says that the provider order says cefalozolin 500 mgs IM every 8 hours. So the medication is supplied as with the label. So the question is, how many mLs should you administer round to the nearest tenth? All right. So I like to start with what the physician orders. So we're going to start with 500 mgs, and I use dimensional analysis, and then I'm going to go to the problem. So the problem says that there is 225 mgs per ml. So we know that if, in order to cancel out, if mgs is on the top, mgs need to be on the bottom down here. So we're going to do 225 mgs is 1 per 1 ml. All right. So our mgs cancel out. So we're then going to divide 500 divided by 225. And you should get 2.22 mLs. But the problem tells us to round to the nearest tenth. So we would get 2.2 mLs. And you guys bear with me trying to write with this thing. All right, so we get 2.2 mLs. All right, so that will be the answer for this one. We're going to do another one, and then we're going to jump into the skill, okay? So let's do another one. So it says that the provider order says cefalozolin 340 mgs IM every 8 hours. So the medication is supplied with the label below. So how many mLs should you administer round to the nearest tenth? So we're going to start with the physician's order. So the physician ordered 340 mgs. So this is the same label from the last problem. So we know that there is 225 mgs per ml. So we're going to put 225 mgs and then ml is going to go on top. So our mg's is going to cancel out, and we're going to be left with ml's. So we're going to divide 340 divided by 225, and we're going to get 1.511. So your question says round to the nearest tenth. So we're going to round this to 1.5 mLs. You guys, so let's get started with the skill part. So we just did a problem that said that we would give the patient 1.5 mLs. So your medication is going to come like this. If it needs to be reconstituted, it will come like this. It's going to come as this powdered solution. So you see it? It's powder. All right, so you then, from reading the problem, you know what you need to dilute with. So you don't want to automatically assume that you're going to use sterile water. You want to read it, because sometimes you use dextrose. Sometimes you use normal saline. So you want to make sure that you read your problem. So we read our problem, and our problem said that we're going to dilute it with 2.2 mLs of sterile water. So I have my sterile water right here. What else are you going to need? You're going to need you a needle. So what I'm using is a blunt tip needle. But if you have needleless needles, then you can use those. And then you're going to need a syringe. So when it comes to how big your syringe is, we already worked the math problem out. So we know that we need to administer 1.5 mLs. So I have a 3 ml syringe. So let's say that I had to administer, let's say 0.5 mLs. I wouldn't get a 10 ml syringe. Does that make sense? So you want to make sure that you're choosing the appropriate syringe. All right, so we have our medication, we have our sterile water, we have our needle, and we have our syringe. So we want to bring an alcohol pad. You want to go ahead and perform hand hygiene. And then we want to put on our gloves. All right, so I'm just going to go ahead and assemble my syringe and needle. So all you have to do is take this and then twist it on, and there you go. All right, so then I'm going to go ahead and take the cap off of my water, and then I'm going to go ahead and take the cap off of my medication. So you can just go ahead and clean your hub on both and let it dry. All right, so we know that we are going to give 2.2 mLs. So what I like to do is I like to still draw back the 2.2 mLs of air. So you want to get it as accurate as you can. So I'm about right here. That's going to be 2.2 ml. So then we're going to go inside our sterile water, and we're just going to inject the air inside our sterile water. So you guys remember that you're injecting air in here just so that you're able to pull back the medication. So let's say you skip this step. Will the medication come out? Yeah, sometimes it will, but sometimes it won't. So just a rule of thumb, just make sure that you're injecting air. So then we're going to invert, and then we're going to pull back. So we're going to pull back our 2.2 mLs of sterile water. Okay. And there's it right there. If I got any bubbles, I'm going to get that out. All right, so then this is our medication. So then we're going to add this 2.2 mLs of sterile water in. Make sure that you turn your medicine and mixing it up. So we're going to take our same needle, because I didn't show it on camera, But what I did was, we don't recap needles, but we can do the little scoop. We can do the little scoop method. So what are we going to do? We're going to clean the top of this hub, and then we're going to go in and draw our medication. All right, so we're going to be giving our patient 1.5 ml. So we're going to draw back our 1.5 mLs of air, and then we're going to inject it in here, and then we're going to pull back. All right, so then I have 1.5 mLs. So if this medication is to be given IM, I would take my cap, and then I would just do the scoop method right here, and then I would take this off and then apply the appropriate needle. I hope this video was helpful, you guys. And that's a wrap. Thanks for watching. If you enjoyed this video, share with your classmates so you all can pass nursing school together. See you guys in the next lesson.